So, red flags. What are the red flags? Generally, in the clinical evaluation, red flags are some information that make us worry. Yes, because as we told already, the low back pain is frequently self-limiting. Yes, so whether you will do something or not, it will just pass. Yes, in most of the cases. However, in some cases, it would not. In some cases, it is related to something dangerous. In some cases, some fast and intensive treatment is necessary for the patient. So, what are those red flags? Yes. Yes. Okay, here. So, for example, what we are afraid of is the malignant conditions. So the malignant spinal condition, generally, usually we have the metastasis, yes, so the cancer that is spreading from some other place. And generally, so in general, patients with benign mechanical lower back pain should have pain mainly with the spinal movements such as sitting, bending, lifting, twisting, and the pain should improve while lying down and at night. If it's not true, if it's not improving in the night, we may be a bit anxious, yes? So, benign diagnosis of exclusion such as muscle strain, ligamentous strain should be made with caution in the presence of red flags. And if the medical personnel gets that this is something benign too fast, it may lead to problem. So, what are the red flags? Oh, one more time. Age. Patient less than 20 or over 50 years of age. Less than 20 because children should not be painful, yes, without any trauma. And more than 50 years of age, it is extremely common that they would have the low back pain, but it's also far more common that it will be because of some conditions that are dangerous. Yes, there are far more cancer, for example, in this population. Okay. Duration of symptoms. When it's lasting over 3 months without any other associated flag, it is usually of the benign conditions. Yes. If it's acute, it is far more frequently something dangerous. History of trauma. If there was some significant traumatic injury, it may lead to some problems, some abnormalities of the structure that could exacerbate with time, and that may need some treatment, some surgery, for example. Presence of the constitutional symptoms, like the fever, chills, malaise, night sweats, and so on. It may be caused, for example, by the infection of the spine, and this is very dangerous. It may lead to destruction of the spine. It may lead to infection of the spinal cord and brain. It can lead to a lot of very severe complications. Presence of systemic illness, yes, like the patients with the history of cancer, recent bacterial infections, intravenous drug abuse, immunosuppression, organ transplantation. So generally, whether we have something strange with the patient. Also, when the pain is unrelenting, yes, so we are trying to give some drugs. For example, we are trying to get some manual therapy, and it does not help. Presence of the caudal equinus, generally presence of any neurological symptoms. Yes, patient is losing ability to sense touch, vibrations. Patient loses the ability to move the limb, things like that. Or there is some tingling sensation, some paresthesias. It is generally quite dangerous.